Assalamu alaikum, dear listeners. I am Saxataliyeva docent of the Urology Department, Andhra State Medical Institute. Today we should discuss about leukoplakia of the bladder. The bladder leukoplakia is a pathological condition in which the stratified squamous epithelium becomes keratinized and ceases to produce glycogen. Normally, the mucous membrane of the renal bladder, including the stratified squamous epithelium and that covers it, constantly synthesizes glycogen, which protects the inner walls of the organ from the aggressive environment of urine. However, in leukoplakia, the function of the stratified squamous epithelium is disrupted. Areas appear in the tissues with cells that stop producing glycogen. That's why it's gradually keratinized and begin to peel off, exposing the submucosal layer and making it vulnerable to damaging factors. As you know, the leukoplakia is by statistics of science in the world. 42% of patients with bladder leukoplakia develop its cancer. That's why leukoplakia of the bladder we should know is pre-cancer among the oncology diseases. Additional problems arise from the fact that early diagnosis of the leukoplakia difficulty initially. The disease usually does not manifest itself in any way, and the patient goes to the hospital on the later stages of its development. The main criteria for the pathology are symptoms of bladder irritation, frequent urination with sudden urges, immaterial leakage of urine, and increased excretion of squamous epithelial cells. For example, in the causes of these diseases, urinary tract infection, it has a top degree of this among the most common cause of metaplasia, replacement of one of type of tissue with another. These infections contribute to the development of inflammation, for example, cystitis. Due to the corresponding immune system response, the main culprits in the development of bladder leukoplakia, for example, Escherichia coli praetus and Escherichia fecalis. Genetic factors in bladder cancer, mutation in the p53 and QS genes are often observed as defects lead to uncontrolled growth of tumor cells. They may also be accompanied by metaplasia of the stratified epithelium. External and internal irritants of the bladder include catheters, stones, fistulas, tumors, congenital abscess, types of chronic course of the anterior wall of the bladder, extrophy, nervous system disorders, and previous surgeries. All of these factors can lead to disturbances in the functioning of the epithelium and keratinization. The symptoms of bladder leukoplakia consist in the hematuria, blood in the urine, indicating damage to the walls of the urinary tract, dysuria, painful urination accompanied by sharp or burning pain, sometimes manifested as tolerable discomfort which also involved inside. Problem of aching pain in the lower abdomen when the bladder is full, stranguria, difficult urination in which the patient has to strain the abdominal muscles, assume a certain position, take diuretics, or use other methods to empty the bladder. The symptoms also indicate the presence of stone or tumors in the bladder or ureters. Polyuria, frequent urge to urinate, ardent urge to urinate that cannot be ignored, feeling an incomplete bladder emptying. Intermittent stream may indicate barriers to normal and urine flow. Next words is pathogenesis. This disease is morphological change with a lack of protective polysaccharides exposes to submucosal layer. As you know, keratinized epithelial cells form with stone keratin, causing the leukoplakia area to become covered with white liquid. This is how metaplasia occurs, the replacement of some cells by others. A distinctive feature of metaplasia is that both cell types present the same type of tissues. According to statistics, the pathological process of epithelial cells transformation most often affects the area of the Leo triangle. It's located at the bottom of the bladder and it's bounded by ureter offerences. As you know, the classification and stages of these diseases, it consists squamous cells modulate stage. In this stage, bladder cells begin to change under the influence of a source of the chronic irritation or inflammation, such as recurrent urinary tract infections, bladder stones, or long-term catheterization. In response to constant damage, the cells of the multilayered epithelium become more resistant. The process is called modulation. Squamous metaplasia second stage is characterized by significant changes in epithelium cells. A white film or patch appears on the surfaces of the inner wall of the bladder, leukoplakia. Squamous cell metaplasia, it's a keratinization stage. This is the last and the most dangerous stage of leukoplakia development because this long-term exposure to the irritant squamous cells begin to actively produce keratin, a protein that forms the upper layer of the skin, protecting it from external influences. As a result, the keratin layer forms on the areas of the leukoplakia, which further thickens the affected area. This stage is associated with other serious conditions, including kidney stones, ulcers, and scarring, as well as increased risk of cancer. In pathomorphological classification, these diseases has flat and simple forms of leukoplakia, varicose forms, and erosive forms. In this picture, you can see is a flat of simple form when the focal hyperplasia and the acanthosis of covering epithelium are detected, and parakeratosis is detected in some areas. As you know, is with the prolonged types of these causes of the process, foci of sclerosis and fibrosis appear in separated area of the submucosal layer. And the second one of the varicose leukoplakia, second stage of these types of diseases, you can see the cells of the parabasals and granular layers of squamous epithelium are edematous and enlarged. Due to increased hyperkeratosis, foci or parakeratosis appear. It has been determined that the layers of cells, the granular layer, have increased, turning into 5 or 4 rows. And as you saw these pictures in these types of topographic change, the composition of the covering multilayered squamous epithelium. In these layers, there is a relatively greater destruction of epithelial cells, blurring of the boundaries of the system membrane, and intensification of the keratinization process. The third one of the types is the erosive form of leukoplakia. It's a dangerous degrees types of this disease because it's various mechanical and thermal effects result in formation of erosive foci, leading to the development of the erosive form of leukoplakia, which was established. The erosive form of leukoplakia has been determined that the basement membrane between the layers is completely split and aqueous and unclear structure. As a result, it was observed that the epithelial cells of the basal layer are separated from the basement membrane and are in suspended state, as well as disconnected from the cells of the surface layer. On histological pictures, you can see it was determined that the space between the cells of the spinous layer had expanded, the rejection had occurred, and foci of erosion had appeared, hyperemia, plasmorrhagia, dystrophy, and destruction of the parietal structures of the vessel were observed, as well as activation of proliferating inflammatory cells, the largest and hyperchromic cell nucleus. In this picture, you can see the cystoscopy, the spots, and the leukoplakias. So, in some causes, squamous cell metaplasia occurs with keratinization. It's separated of two types of growth. It's non-keratinizing and keratinizing squamous. The first one occurs in the most women of reproductive age, slightly less frequently during menopause, and is usually considered normal. It's accompanied by frequent urination, does not lead to cancer. It can develop in men undergoing hormone treatment for prostate cancer. is characterized by glycogen accumulation to histological examination usually shows round-shaped cells. Next, one of the keratinizing squamous cell metaplasia is associated with prolonged irritation of the blood mucus. It's accompanied by formation of gray or white spots in the reddened and swollen hyperemic mucus, which can be seen with cystoscopic examination, and manifests itself as hyperkeratous pathological keratinization of the squamous epithelium and may provoke the development of cancer or be associated with it. In pathomorphological types of the keratinizing subtype of bladder leukoplakia, it consists thickening and the elongation of epithelium fossils combined in some cases with increase and hypertrophy of the rows of cells and spinous layer, and other causes with pronounced proliferation of cells in the basal layer. Second one of these of keratinizing subtype bladder leukoplakia is a severe rows of branching cells with the oval or flattened enlarged locally appeared on the surfaces of the squamous epithelium in areas of parakeratosis in the form of necrobiosis. In the simple form of the leukoplakia, areas of branching cells are located in the form of a dense plate in parallel to the malpighious layer, as you saw in these pictures. Since leukoplakia is a precancerous conditions, it's determined the degree of expression of tumor markers. It's markers of glycoprotein cytokeratin marker, protein P53, and BCL2 protein. These pathomorphological types of cytokeratin bladder leukoplakia, the initial stage, first stage of leukoplakia development when the metaplastic process occurs in the change in epithelium, increase in expression of the cytokeratin to high level was observed. In this picture, you can see this figure in the stage second and the third types of degrees of metaplasia developing in the cells of all layers of the epithelium. Inflammation was detected in the lamina propria, and the cytokeratin was expressed at a high level in all epithelial cells. Information about the P53 genes is the genes factors that control the cell cycle. It's a tumor suppressor gene. It's known that P53 is activated in some precancer diseases, including chronic inflammatory, degenerative, and neoplastic disease of the bladder. The concentration this protein increase, especially in cells that proliferate and multiply, particularly when the hyperplastic and proliferate properties of cells increase with a dysregenerative process. Next one, and you should the normally pictures and to use a PP53 genes and gray types of first, second, and third types leukoplakias of pathomorphological forms of the use these types of genes. The level of BCL2, the result of immunohistochemical examination of an anti-apoptotic protein of epithelial cells showed that in the control group, the cytoplasms of some young and cambial cells located on the basement membrane, the expression of the protein was low on the cells of the intermediate and surface layers. No expression was observed in those. Next one of these of complication of bladder leukoplakia is keratinizing form is associated with a high probability in 42% the transition from metaplasia to malignant tumor lasts from 4 to 28 years. In 10-20%, of course, the squamous cell carcinoma develops simultaneously with metaplasia. Bladder cancer, especially in the later stages, leads to a number of serious complications such as urethral obstruction, profuse hematuria, and severe pain. It can also have metaplasia to other organs and systems, including the lymphatic systems and bones, which worsen the prognosis and the quality of life of the patient. The complication of the bladder leukoplakia, the non-keratinizing form, is associated with cancer, but it can also cause unpleasant complications such as pseudomembranous trigonosis. Chronic inflammation in the area of the bottom of the lethal triangle, which usually occurs against a background of estrogen hyperproduction. Trichonitis is often asymptomatic, but sometimes frequent urination may occur. Long-term leukoplakia also contribute to the development of chronic inflammation. The bladder provokes the formation of stones. When stones move through the ureter, they cause sharp pain and hematuria, sometimes blocking the flow of urine, and some which requires immediate medical attention. The risk of developing these complications increases in the presence of the concomitant factors, chronic bladder infection of prolonged catheterization. Therefore, it's important to undergo regular medical examination, especially if you have the relevant symptoms. Diagnosis of the bladder leukoplakia. First of all, take a medical history. The doctor clarifies the frequency and intensity of pains, combines the characteristics of urinary disorders, the presence of the other pathological and predisposing factors. Gynecological examination in women necessary both as a rule of similar diseases and to assess the general condition of the reproductive system. Laboratory tests, complete blood count, and urinalysis examination of vaginal and urethral swabs, biochemical blood analysis to determine creatinine, urine levels, and PCRs in enzyme-like immunosorbent assay tends to detect hidden infection and identifies the pathogen, which is important for selecting antibiotic treatment and some instrumental diagnostics of called cystoscopy. Its medical history during the interviews, it's necessary to clarify to patient complaints in detail, careful collect their medical history and personal history is personal. Special attention should be paid to the following points. Infection history with emphasis on previous urogenital infections and various types of vaginal dysbiosis. Gynecological states, menstrual function, associated age of manner, duration of menstruation length, and regularity of intervals, nature of sexual activity, use of oral contraceptives, and the nature of discharge from the genitourinary tract not related to menstruation if present, past and concomitant disease, endometriosis, carnets, urethritis, cystitis, previous abdominal and pelvic surgery, and etc. family surgery. Examinations during of the nature of discharge from the urethral-genital tract of abnormal discharge is found, which suspect you should to procure protection of genital herpes, HPV, schinetis, periuterine cystitis, and other diseases. Instrumental diagnostics, the most informed method is considered for cystoscopy, the procedure for taking a piece of tissue for this further histological examination. During cystoscopy, leukoplakia lesion appears as flattened whitish areas, small erosions, or yellowish blocky. In addition to the main diagnostic methods, patients may be prescribed urimetry and endoscopy. Treatment of the bladder leukoplakia is intravesical therapy with anti-inflammatory drugs, hyaluronic acid solution, antibacterial treatment, and physiotherapy, immunocorrection, phytotherapy, and dietary complications. And one of the surgical treatment is used to treat leukoplakia of the bladder with involves removing the affected areas of the bladder mucus. This operation is performed using special instruments, in particular cystoscope. It's inserted to the bladder through the urethra. So the doctor does make the incision. Okay, the prevention is for drug therapy, installation, physiotherapy, and others of these types of treatment. Prevention of the blooders is to lead a healthy lifestyle, treat infections, and maintain good hygiene. So thank you for your attention.